Well, Ren, even though we think we're pros in season two, we've had a bit of a change of plans. We recently held listening sessions across the North Country communities in late January and early February. And we had the chance to sit down with NCH CEO Tom Mee to review and hear his feedback regarding how those went.
Yeah, it was a very exciting opportunity, and we wanted to make sure that we got it to our listeners, our staff, our communities as quickly as possible, so we could hear, what did NCH leadership hear, and what are they doing with that feedback? So, without further ado, here is our interview with Tom Mee around community conversations. Hi, everyone, and welcome to Rural Roots, a road less traveled, a podcast by North Country Healthcare.
We're your hosts. I'm Gavin Cook.
And I'm Ren Anderson, and we're so glad you're here. Gavin, Tom Mee, CEO of North Country Healthcare, joins us again. Welcome back to Rural Roots, Tom.
Thank you, Red and Gavin. Happy to be here.
Yeah, well, glad to have you. And we're excited to talk to you about the last several weeks where you spent some time participating in community conversations across the North Country. Just curious right away, what stood out to you most from these sessions?
Yeah, I think that what really solidified it for me was this overarching sense of community and partnership. That if we are to be successful as an organization, if we are to realize the dream of high reliability, that it can't be an independent effort on behalf of NCH and our administrative structure. It needs to be a true partnership with our communities. And I think that if there was one theme that was consistently received by myself, is that there's a general misunderstanding of what an integrated health system does. And it's something that you take for granted because this is the life I've lived for 40 years. And the people in these communities have only known independent, autonomous critical access hospitals. They don't know what life looks like in a system. They didn't necessarily know that there are certain sacrifices that need to be made. And there is some loss of local control, but it's all within the theme of a regional healthcare approach. And it was a good milestone for us to have gone through that.
That's great. And can you just talk, you mentioned, what does integrated healthcare as a system look like? What should the North Country expect as North Country healthcare grows and solidifies?
So the concept of an integrated health system was really most recently introduced to our stakeholders 4 years ago as we went into strategic planning. And it boiled down to a very fundamental question. And it really led to all of the steps that we're taking now. And it is, what are we? Are we three independent yet interdependent critical access hospitals with a home care and hospice entity, or are we a regional healthcare system that offers 66 beds for inpatient services and providing inpatient services in various locations? And the answer overwhelmingly is the latter. So an integrated health system in this case is creating a unified leadership structure so that we manage the affiliates of NCH consistently without variation. That feeds directly into the concepts of high reliability, but it also recognizes that we don't necessarily need a myriad of decision makers for common issues. For example, you look at the role of the president and the CEO, for example, very demanding role, but the reality is that the number of issues they manage are not any different based on the geography. So what we're doing is we're looking at positions in which we can combine them and offer a more unified, much more streamlined approach to leadership. And that really gets to the essence of what an integrative structure looks like, so that we have a single leadership team leading the 66-bed integrated health system.
Yeah. And I'm curious, how does that affect both the staff experience to have this integrated leadership team as well as the patient experience?
Yeah, I mean, change is difficult for people, and it comes with a recognition. And we hear this a lot, whether it's NCH or really any other entity, is that isn't the way that we do things here. And everybody is doing things slightly different. So there really isn't a Weeks way or an AVH way. There needs to be an NCH way. So what we do is we work our best to identify what the best practice is for any given process, whether that's revenue cycle activity, or giving a patient aspirin that prevents with chest pain, and how we do it consistently every single time so that a patient, a nurse, a practitioner, whether they're providing care or receiving care in Berlin, it shouldn't look or feel any different than the same procedure at Colebrook or Lancaster.
Yeah. And I've heard you say several times that it comes down to patient safety.
Yeah.
Yeah.
Yep, identify the best way and then hardwire. And there's no better example of that than our bedside medication verification process and barcode scanning that we've recently received national accolades for. Now, is it important that we give medication safely? Of course it is. But the gold standard is 95%, where most systems would have launched, or where most systems would have stopped. But we identified the need to create a process and hardwire it. And we chose bedside medication verification to do that so that it's done the same way every single time. And we're getting compliance rates of 99.9%. And that may not sound impressive, but that is literally hundreds of medications administrations a day that we're giving in a safe manner. So was it about administration of medications? Absolutely. But mostly it was about showing the organization and our stakeholders that when we have the resources and when we take a process and apply the principles of high reliability, that we can make it seamless and hardwired. And we're always going to have that success now. That'll never change.
That's amazing.
That's great. And Tom, just out of curiosity, as we talk about the patients and this information with these community listening sessions, we were in 4 separate communities where we had or held these listening sessions. So could you talk about some, concerns or consistent feedback that was brought up at each listening session?
Sure. For the most part, the feedback was consistent. Where we did see some variation based on geography was more relative to the number of services. Are you planning to add this? Are you planning to take this away? So people are very concerned about services that we have today and what that'll look like going into the future. And we are very transparent that there are no plans to discontinue any services at this point in time. And, never say never, but it was really the first step in an extremely transparent conversation with our communities that for the most part, the services that you see today will still be there tomorrow, only improved.
That's great. And were there any questions that surprised you?
Yeah, I think the questions about, look, one thing that was very, very obvious through this is that if we didn't provide information, that void was quickly filled with misinformation. So there were questions about where I live, for example, and that was surprising because a number of years ago, there was a narrative that I didn't live in the North Country, which is pretty unusual since I've been a full-time resident for 7 years. But yes, some of those were relatively surprising.
And where did you feel the most pride in how our teams or North Country Healthcare was described?
Oh my gosh. I mean, we intentionally surrounded these rooms with our yellow belt poster presentations because who couldn't look at that and walk away unimpressed from that? So, look, you guys have heard me say this ad nauseum, but that's really the highlight of high reliability is looking at the work that our own staff have done and look at what individual employees can do when they're empowered with the training and the tools and the time to improve patient care. I'm most proud of that because it's very unique to the North Country. There's a myriad of things that I'm proud of on any given day, but there are achievements that many other health systems have achieved as well. But this, as it relates to the Yellow Belt process and the poster presentations, empowering direct line staff to improve their environment, that's something that's uniquely NCH.
Yeah. We had Claire and Abby on to talk about the Yellow Belt showcase a few months ago now. And it was, I think I shared when I walked around the showcase and I felt it again during the community conversations, it's every single one. You were like, oh my gosh, I didn't even think we could be wasting in this way. And look at that improvement. Oh my goodness. Of course, that makes more sense.
Right.
And it's just so inspiring that comes from every level. line level on, to make not only their workplace experience more fulfilling, but to improve the experience of patients and our communities.
Yeah. Yeah, Ren, and that's a consistent finding with all of these initiatives. It's just going through the process leads to untold opportunities and improvements. Look at what we recently did in just flow charting, the process mapping, the ED, our pain services, our behavioral health, and looking at how a patient accesses those symptoms. We ended up with a flow chart that was, I'm sure you've seen it, thousands and thousands and thousands of steps, but with expert eyes, deference to expertise, looking at it, just doing that process identified a myriad of opportunities that we improved on immediately.
Yeah. And so your goal was to map the emergency department. Was there anything in particular that you found that you could take immediate action on?
Yeah,
Just
there
think,
were.
yeah.
Yes, there were a number of things related to EMTALA, the Emergency Medical Treatment and Active Labor Act, that needed to be cleaned up. And that's really our obligation when a patient presents to the ED with what they perceive as a life-threatening issue and how we respond to that. We found some inconsistencies there. Nothing that kept me awake at night, but we found some inconsistencies and things that we could improve immediately.
That's amazing. Yeah. So I'm thinking about the community conversations again, and as a healthcare leader, what does it mean to truly listen, especially when sometimes feedback is hard to hear?
Yeah.
We talk as a culture of feedback as a gift, but it can still hit hard.
Yeah.
So as a healthcare leader, what does listening look like for you?
It can oftentimes be difficult because it's a statement I don't necessarily love, but perception is reality. And if their perception is that we're missing the boat in an area, then I need to respond to that, whether or not it's factual. And it again goes back to the information versus misinformation. If their perception is that we're not adding primary care physicians by design, then I got to address that. And yes, it's not comfortable hearing some of that. But these aren't designed to be comfortable. If these were comfortable conversations, we're probably not making the level of change that we need to be.
Well, maybe at some point, instead of community conversations, we'll have a comfortable conversation series.
Yeah.
So,
Well, and Tom, speaking of kind of that, being uncomfortable, I'm curious, what would you say to staff who may feel slightly discouraged by some of the criticism that was shared?
Well, I think every criticism is an opportunity for improvement, and you've got to look at the opportunity and not the situation that you're in. So, yeah, it's really just looking at these challenges as opportunities, and the joy you feel when these things are ultimately turned around. Look, when we looked at that process years ago of the time period between biopsies of actual positive mammogramming. That's the kind of stuff that it just makes you feel good all around knowing it. And that doesn't make the press, and people aren't going to know that these changes were made. But when you can lie in bed at night and the last thought is that this is something that we did today to improve the health of our communities, then that's what it takes to keep going.
we heard you talk a little bit about primary care provider and the perception that our communities had. Many communities did speak about access, staffing, and communication on whole. How is North Country Healthcare thinking about those issues moving forward, and how are leaders, your leadership team, really looking to carry these listening sessions and actions from them going forward?
Yeah, I mean, our priority list is huge, but primary care recruitment and creating that primary care foundation, I think, is going to remain at the top of our priority list for the unforeseen future. It's, I saw some data recently that was very surprising to me, that Coos County actually has the second highest rate of PCPs per 100,000 population. That astounds me because it takes weeks to get a primary care provider in our communities. And that all begins with that strong primary. We're nothing without a strong primary care foundation. Otherwise, our ERs become overloaded with urgent care type stuff. So obviously the residency is a big part of that, a multi-year effort made to establish a family medicine residency. And beginning next year, we'll have 4 residents a year. So beginning in 2030, we will graduate our first class of 4 primary care family medicine residents. And while there's no guarantee that they all stay in the North Country, we're going to work our behinds off for those 3 years to make sure that they do.
Yeah. Creating that stickiness, right? So that they want to stay.
Yeah, it's
Uh,
all about relationships, whether it's a relationship between a patient and a provider or our relationships with communities in this case. If we can get a young, impressionable resident and we have 3 years to establish those relationships, I'm confident that we can make that a success.
And you spoke earlier about, needing our partners as much as the community does. Can you talk a little bit about that partnership for the residency and who we're working with to make it happen?
Yeah, we've elected a consortium model. I mean, NCH is not an academic medical center like Dartmouth or UVM or Maine Med or something like that. So we have established a consortium model, which means that we have partners that we work with for the training of their residents. Our primary partner is Coas Connolly Family Health Services. That's really the ground level of where the residents will be doing the bulk of their outpatient work. Their inpatient work will be done within the NCH hospitals. OB, we're partnering with Littleton Regional Hospital, obviously in Littleton, because we only do 80 deliveries a year. So it's just not enough volume for a good teaching experience. And for the pediatric rotation, we'll actually be sending our residents to Children's Hospital of Detroit, and where they will obviously see, which is a massive multi-hundred bed pediatric facility in Detroit, Michigan. And they will see more there in a month than they'd probably see in a year here in the North Country. So we're excited about that as well. But again, another example of how we work with partners to achieve a mission.
Yeah, absolutely.
That's great. And speaking of an overall mission, I'm curious if you've noticed being in this system that we are in, did it help to create, some form of strength in the way you provided feedback, not only at these listening sessions, but just in general? I think it'd be an important note for the communities to hear that piece of just strength in general, because that's kind of what the North Country has always been built on.
Yeah, I think that if there's a challenge that was identified coming out of this, for me at least, it's how do we possibly communicate effectively with these communities that, range in ages from birth to 100 years old, and how do we communicate? And I think one of the ways that we do this immediately is through the establishment of a patient family advisory group, which we spoke at all of these sessions, which is a formal session where we invite the patient directly into the decision-making process. And we talk about things like, when do we send people to collections? What are the visiting out? Things like that. So I think that there are opportunities for more collaboration. But at the end of the day, there was one lady who was really impressed. She said, "Why don't you just put an ad in the newspaper every week?" And it took me back to this doesn't have to be complicated. And sometimes I think we analyze these things to death. And in some cases, maybe it is as simple as putting an article in the paper every week. But there's certainly be more to it than that. But certainly a challenge.
Well, and we're working to continue to engage community beyond these 5 sessions, right? So we're setting up 5 for the April, May timeframe, as well as October. And what are you looking forward to as we continue these conversations with our community?
Well, I think that we'll begin to have the conversations will be more pleasant. We won't be talking about laying people off or effective revenue cycle processes. We'll be talking things about what services we're adding and sharing, patient outcomes and data, things that really put us in a more favorable light. But I'm also looking forward to exposing more members of the NCH administrative team to the communities. I mean, this isn't about me. I shouldn't be the face of NCH. There's a whole team of 1,100 individuals that work every day tirelessly to support this organization. I'm looking forward to giving them some airtime as well.
That's great. That's great.
That's great. And I think as we approach our ending time here, I just have a kind of a two-sided question. So this is where Ren said before I get a little wordy. So I'll do part 1 first, which is, I would love to know and hear how these listening sessions affected you on a personal level.
A great question. Certainly, there's a lot of mystery going into these about what would we experience, and if nothing else, the last few years have taught me that people will say anything when there's an opportunity to do so. So there was certainly some anxiety going into these sessions, but look, man, I'm confident in what we're doing, and we have created the recipe for survivability of the rural health system here in northern New Hampshire, and I love talking about it. So yes, what was there anxiety going into these? Yeah, but at the end of the day, there was profound um, gratitude for just being in this opportunity to talk.
That's wonderful. The second part of my question was, what keeps you going? But you kind of answered it. So.
Well, I am curious though. I'll take Gavin's signature question. We know that you love to hunt and fish. Did you have a chance to kind of decompress after these listening sessions? Did you do anything exciting?
Yes, I traveled to Michigan to be present for the birth of my granddaughter on February 10th.
Congrats.
So, yeah, she is my first granddaughter, and love her to death, Scarlet Grace, and looking forward to seeing her milestones.
Oh, that's wonderful. Well, Tom, congratulations. Thank you so much for joining us again on season
pleasure.
2. Anything else you want to tell our listeners before we wrap up?
No, looking forward to future, and I think we should add some hunting and fishing advice to these.
I love it.
Where's the hot bite in northern New Hampshire? So,
Do you have any ice fishing tips for us?
yeah, dress warm.
Yeah. I love it. All right. Well, season 3, we'll make sure that we have a hunting and fishing spotlight
All right.
for you. All right. Thanks so much, Tom.
Thanks,
Thank you.
Tom.
What a wonderful conversation, Gavin. And, I think people hear the CEO and they sit up and they check their posture a little bit. But I think you can really tell from that conversation with Tom that he's listening. He's taking it seriously. And it's a heart, I think.
Yeah, and I do really I appreciate the human aspect of Tom. I know a lot of people see the business side more frequently, but I think these sort of conversations bring out that human side. And again, you said it. You hear the CEO title and you think, you got to sit up. It's all in the title, but he really does bring the human aspect to it, and just the way he spoke, and answered our questions alone, I think speaks volumes to the type of person he is. And speaking from somebody who, didn't get to attend all of the listening sessions, it really was nice to hear his side of how he engaged and how he actively listened and what he took out of those sessions. It's really nice as an employee and as a North Country. I'm born and raised there. It's nice to hear that feedback.
Yeah. Yeah, and I really do. I did have the pleasure of going to all of the community conversations, and I really think Tom and his whole team took it very seriously, and I think that they listened, and they're going to tune some changes, which is it's wonderful to see leaders not only stand up to take the feedback, but then enact the feedback. And that can be one of the hardest roles any human has in any
Absolutely.
position that they have. Feedback's not easy.
Right.
And we talked about it a little bit with Tom. It's not easy to receive feedback, especially when that feedback is not rainbows and butterflies, and so much feedback really isn't.
Yeah. And I can say that, I obviously have family and friends in multiple communities where the sessions were held. And the biggest feedback I heard from them was they were just thrilled to see that we want to listen and that we're actively engaging them.
Yeah.
Because I think that was the feedback that Tom mentioned that we were getting from the community was the listening. So I was glad to get that feedback as well.
Yeah. And we're still waiting on information back from the Carsey Institute, who are our partners in this. But and setting those final dates for April and October. But we're really excited that this is just the start of our
Yep.
community conversations and the start of how we really change how we capture that patient voice from our community. So it's a really exciting time to be at North Country Healthcare for so many reasons, but I think, this concentration on communication is the most exciting to me.
Absolutely. Said perfectly. Well, as we mentioned at the start of this episode, we originally had Stephen Legge lined up for today's episode. So he will be next week's episode. So hopefully you all will be tuned in for that one.
Yeah, can't wait. He was a real hoot.
Yes.
Well, until then, I'm Ren.
And I'm Gavin. And this is Rural Roots, a road less traveled.